about a destination, but a process. It's about how you drive, not where you're going. Hello everyone, I am Shivani Sharma, and today we are in conversation with Dr. Nidhi Barthwal. She's a psychologist. Welcome, ma'am. I would like you to start by introducing yourself and your present designation in Chitkara.
Yes, sure. My name is Dr. Nidhi and I'm presently working as a student counselor here at Chitkara University. So basically I've done PhD in psychology, experimental and cognitive psychology. Before that I did my master's MSc from Bangalore, Christ University, and I'm interested in psychology since a very long time, like since 11th class I'm having this subject. Apart from that, I've worked with various schools and before joining Chitkara. So yeah, I love this field.
So, ma'am, how has been your experience till now working for like various schools and now in a university?
It's lovely because when I was in school, I feel that the transformation actually starts during childhood. So that time my focus was more on how can I contribute in grooming a child, and how with collaboration, of course, with the parents and teachers, how can we mold the child. And now when at the university, I feel that like you guys, know what you want to do, you have a clearer vision. So basically now I feel that it's more of motivation and guidance, and showing consequences of both the sides, because I feel that today's youth is well aware of what they're doing.
So, ma'am, what is psychology? Just to introduce the word to the audience, and people often confuse between a psychologist and a psychiatrist. So, it would be great if you could just distinguish it for the students.
Yeah, sure. Basically, psychology is not reading minds. I would like to say that, because a lot of people confuse it by saying that, okay, so you are psychology, can you tell me what am I thinking? So this is not psychology. It is basically the study of behavior, like why an individual is doing whatever he or she is doing, what are the causes behind it, what is the history of that particular individual, and what is the root cause. So basically we try to map and we try to analyze a particular behavior looking at the past. So for us, history, past is very important, because that is what makes us an individual in the present.
So, ma'am, difference between?
Yes, psychologists, they cannot prescribe medicine. They do not have a medicine background, and whereas psychiatrists, they can prescribe medicine. So basically, when a child or a student or anybody has some kind of problem, they think something is wrong, so they are going to come to the psychologist and they are going to talk about the issues. If we think that, okay, no, I think that yes, therapy is going to work, but at the same time medication is also important.
Yes.
So we are going to refer that particular individual to the psychiatrist. But both goes hand in hand, because psychiatrists will not actually go into the in-depth issue of the particular case, but we do more of therapy, it is more of medication.
So, ma'am, working in Chitkara, how many students visit you, and like what are the common problems that they face?
Okay, so students, it's we on an average we get 3 to 4 cases per day, or sometimes we have follow-up also, because it's not a one session scene. When we see what in first session, we actually try to find out what the problem is, and then in the consequent sessions we try to seek for the solution. So even if the students coming for the first time, there are 4 to 5 sessions per client. So on an average we see 3 to 4 clients in a day. Now students, they are having a lot of generational gap with their parents, so there is a lot of conflict in what they believe and what their parents believe.
Yes.
And there are a lot of identity issues. There are a lot of doubts regarding career, because they choose a particular thing, and especially after COVID, since a lot of students they did an online mode.
Yes.
And now when they are in the offline mode, the reality is hitting them hard. So they are kind of confused whether they should have chosen something else rather than this. And relationships, yes, those are the kind of things that we see.
So, ma'am, what do you think are the root causes of all the mental disorders or students coming with their problems? Are they like everybody is prone to the problems, or there are certain people who are more prone to them?
Okay. So, of course, the first thing, it is always a, you know, contribution of nature and nurture. There is not a single root cause which can actually identify, or I can say that the person who has depression must be having this reason, because it's always an interplay between hereditary, that is genes. So sometimes the causes are really unknown, especially when it's hereditary. Yes, of course, environment plays a very, very important role. A child who is given an environment of a very calm and composed kind of atmosphere, and a child who is given a very abusive kind of atmosphere, it is going to have, differences. They are going to, they'll be brought up to be a different kind of individuals, both of them. So, yes, environment, even if genetic plays a role, I feel environment, if provided a good environment, it can actually help a lot.
So, ma'am, what can really be done on an individual level to combat certain disorders or certain stressful situations?
Okay. Firstly, I think it varies from a disorder to disorder, or a life crisis. There is no general blueprint that one can read and they can understand that this is the way of dealing it. It's a very personal way of coping, and at the same time, we need to reflect back on ourselves, see where we are, having acceptance of the situation. If I belong to a particular family, or I have this particular parenting type, so I need to accept that this is the reality. Now,
Right.
I can't be in denial and say, why are my parents like this, or why are they, always scolding me, or why did I get them? Rather than that, I think having that sense of acknowledging that this is the reality, and now what can be done regarding that, how can we deal with it now. So I think accepting and reflecting back your own feelings is very important.
So, ma'am, I have seen many of my friends, like they are in a lot of problems, mental issues, but they are not willing to see a psychologist or counselor. So, I think willingness is important. You can't just force someone to go for counseling. So, what can be done in this case?
Right. I feel that yes, trend is changing. If I
Yes.
compare it with the last 5 to 7 years, I feel that people are being more understanding towards mental health, and I think we together can be a lot more helpful than somebody propagating about what counseling is. For example, if you are here and we are talking, so whenever you meet somebody and somebody tells you that I am having this kind of problem, so we can tell that person, see, you can seek help, it's very normal, rather than saying that you don't need any help. So I think if we all are supportive as a community, it is going to really change people's perspective towards counseling. And it's like having hypertension, it's like having blood pressure. It's very normal, it's very common, and we all are dealing with our own issues.
Yeah, I mean, it's like once someone break a bone or something, there's a fracture. So everybody can see that there's a fracture, and everybody can recognize it and like tell about it. Ki, okay, it's there. But when there's a fracture in the mind, nobody can see it. Maybe the person who is going through can also not recognize it.
Right.
So
That's why the role of caregivers, the role of friends, like the role of the people around us, so we can help each other by making it a very normal thing. As a community, as human beings, we can just be there for each other.
being more affectionate can help.
Yes.
So, ma'am, the budget in this year, 2022-2023, said that telemedications will be like more in regulation. So, what are your thoughts on telemedicine and like online therapy? Because in the COVID times, we were not able to like meet each other physically. So, there were a lot of online counseling that was going on. So, what is the difference between giving an online counseling and sitting in like front of each other and talking about it? So, what's the difference and how effective is that telemedication?
I feel it's a very good initiative, first of all, to start something like that, because yes, it's the need of an hour, and when it comes from the government, people also kind of accept that okay, this is normal, this is happening everywhere. So even if we seek help, it's nothing. It's not something that is not something that people don't want, because now people are acknowledging that it's a very normal thing, first of all. So that's a very good step for a government to start. Secondly, yes, there is a difference in online and offline counseling. Now it depends on the client.
Yes.
For example, there are some people who would feel more comfortable when they are in person talking about it and dealing with it. There are some clients who do not want to share their identity. They don't want to do a video call. They just want to hear it, or they would just want to text. So I think taking out that initiative where you have a choice of going in-person therapy
Yes.
or having access to teletherapy, that is a good thing. That we already have on like offline therapists, but online ab shuru hua hai, so I think it's a good thing. People can choose according to their preferences. So some people are more comfortable like that, some are more comfortable in person.
Ma'am, some people are like already in anxiety and they just don't want to go for counseling for the fact that they don't know what happens in a counseling. They feel that whatever they'll be speaking out there will be, like distributed or told to someone else. Or I mean, they must be having some issues regarding that. So, can you just tell our audience what actually happens in counseling sessions and what is the process?
Yes. So the first thing that we do when a client enters our office is that we tell them that whatever the information is being shared with us, it remains confidential. Now again, that also have few clause. We maintain the confidentiality, but if we feel that the client is suicidal, or if we feel that the client can harm someone else, so we would ask the permission of the client. We would ask them that, now see, this is the case where I feel you're not safe. So I want you to suggest me somebody, your well-wisher, your caregiver, your friend, your brother, your sister, your mother, anybody with whom we can share this information so that you are protected. Not because we want to tell it out loud to everybody,
Yes.
but because for your own safety, we need to have this one person who can actually be together with us in the process.
So, ma'am, like certain meditations, practices, and like Sudarshan Kriya Yoga, Kundalini Yoga, has been found to be very effective in treating mental disorders. So, what do you think in India or today's youth follow these kind of meditations, or like are they effective, or can one start with this, and can someone opt for some meditation classes, or is it safe for them to start it by themselves?
I feel that researches have been conducted since so long, which are already emphasizing on the role of yoga, meditation, and everything. Yes, it does make a difference, but at the same time, you need to have an inclination towards it. If I ask somebody to sit for meditation, somebody who's not interested, then I think it's the wastage of time. We as an individual should be aware about what do we choose. Is yoga my thing, or should I just run for 5 minutes and feel okay? Should I practice mindfulness for 5 minutes, or should I just go outside, eat and make my mood okay, or talk to my friends? So we need to choose our own best technique. Everything works well, but we need to see what fits our model, which fits our identity more. Only then we are going to follow it. Otherwise, it's of no use, of course.
So, ma'am, any book recommendations for getting to know more about psychology disorders and like healing?
I feel that especially for disorders, I don't recommend reading any book, especially Google, because nowadays what is happening, a lot of students come to us and they what do they do when they feel some kind of anxiety or they feel some kind of stress? They Google it, and then it makes them more
stressful.
The situation more stressful. So I think rather than that, we need to find out whatever you choose, it should be authentic, from an authentic source. Not a random Facebook message, not a random WhatsApp message. This thing is going on ki WhatsApp, maybe some people follow it, do these things and you will feel fine, eat these things. So I don't think that reading anonymous messages or anonymous posts are going to help us. But if you really want to know about disorders, then a proper DSM criteria procedure is there. The American
Psychiatric
Association has actually given the protocol of what are the disorders and what are the symptoms and everything. And if you really want to know if you have something, it's best to meet the therapist rather than reading any book. because it is going to confuse you more. So seek, if you think you need help, just go there, seek a professional, talk to your caregiver and move forward with it.
What goes in the mind of a counselor once someone gets to them, and like what is the whole thought process and how they deal with all the, as everybody who comes to the counselor is like unburdening their emotional stuff and telling about their problems. So I think the counselor must get like burdened with all that. So what is their process of unburdening themselves?
Yeah, I think it's a very valid question because it does happen. Sometimes even we go through burnout. Sometimes there is a lot of transference also. For example, if I am somebody who's being, for example, if I am being abused, this is just an example, hypothetical, and a female comes to me who's being abused, then what am I going to do? I'm going to form an association with the female that, oh my god, this is wrong, this is something that is happening with you. I am going to go beyond sympathy,
yes,
which is not really right. It is a professional relationship. So I don't know if you are aware or not, but sometimes we also go for our own, it is not called a counseling session, but much more experienced than us, we also go for our own personal therapy, where we share our own apprehensions and we share our own experiences and we deal with our own issues. We have to work while working with others. So it's not that we go home and just don't think about it and we are all okay. It does affect us and we also deal with it.
Yeah, ma'am. I have also read a book called Maybe You Should Talk to Someone by Laurie Gottlieb, where she has written all the instances of her counseling sessions. And at the same time, she was going through certain mental issues. So she also took like the help of a counselor. At the same time, she was giving therapy, and at the same time she was seeking therapy.
Yes.
So I think that can also happen.
This is actually very true. I don't know how many.
At the end of the day, everybody is a human being. So
of course, yes.
So ma'am, at the end of the interview, I would like you to give some message to the youth of today regarding.
Yeah, I feel that you all are aware about where your life is heading to. You all are very clear about what you believe in and what you don't. You are well aware of your choices. But at the same time, there are certain things that comes with experience and we cannot deny that. There are certain things where people, especially our parents and or our well-wishers or teachers, they tell us something and sometimes we feel that they are not right. And it's completely fine to have our own opinion about it, but we cannot ignore the fact that they have more experience.
Yes.
We are skilled, yes, you are more skilled and you know internet and you know a lot of things, but experience, it comes with age. And sometimes that also should be taken into consideration. But otherwise, I feel that you know a lot more than we knew when we were of your age.
Yes.
You have more clarity. You know what you're doing, why you're doing. Okay. It's just that you need to sit and reflect back on yourself, on your aspirations, on your needs, on your what you're actually doing with your life. You need a lot of introspection. That is important.
So thank you so much, ma'am, for being with us.
Welcome. Thank you
and
for
imparting all the knowledge to the students. Thank you, ma'am.
Thank you.
This was all about our conversation with Dr. Nidhi Barthwal, covering topics such as meditation, mental health, counseling. Stay tuned for more updates. Thanks for watching.